Remember, skull is made up of both a fixed part and also a movable part. The one movable part of the skull is always the, where is it? Is the mandible. Mandible has got some peculiarity. First bone to start ossification is clavicle. Okay. The second bone to start ossification is mandible. All right. Now skull is made up of flat bone and irregular bone. The area which is made up of flat bones here is called the neurocranium. The other structures which form the facial bones is called the irregular bones. Clear? This facial bone is called the splanchno-cranium or facial cranium. Now what are the important things that you should know here? You have the frontal bone, parietal bone, occipital bone. Sutures connecting the frontal with the parietal. This is called coronal suture. In artificial bones you see better. This is coronal suture. Alright. Then you have a suture in the center which is called the sagittal suture. Now what type of joint is suture? It's fibrous joint, and no movement is possible. Alright. Similarly, when you go behind, you have the occipital bone which joins with the parietal bone. This suture is called as lambdoid suture. The place where the frontal suture, the coronal suture and the sagittal suture meet here, this place is called bregma. Understood? Bregma. Clear? Just see if you have a color chalk piece in that place. Yes. See here, this is bregma. What is the clinical importance of bregma? What is the other name for bregma? Bregma is also called as anterior frontanellae. In newborn child, you can feel that here there is a depression. Clear? That is called soft spot. The importance is this will fuse at the age of 18 months. Clear? So if you see the pediatrician, when the child goes in, newborn child, or after some time when they go, they always feel whether it is closing. So at 18 months, it should close. Understood? Not 18 years, 18 months. This is sagittal suture. The sinus that is related to it is
sagittal sinus.
What is that sinus that is present here? Superior sagittal sinus. Okay, this is sagittal suture. This is lambda or posterior frontanellae. So posterior frontanellae has got no much significance. Anterior frontanellae has got significance. Clear? Okay. See here. You see here there are two nice prominences, right? This is called parietal prominence. Those who have hairs won't know. Those who don't have hairs, yes, you can identify. Parietal prominence. Clear? Alright. Now this parietal prominence is directly related to sensory cortex. Understood? Okay. Now this is about this. Now let us look at the lateral side. This is normal lateralis. Here you will have this bone here, squamous part of temporal bone. You will have frontal bone. You will have greater wing of sphenoid. Understood? Alright? Then you have part of the parietal bone. So this area, this is called as the pterion. What is it called? Pterion. The importance of pterion is this is the thinnest part of the neurocranium. All the other places will be very hard. Here it will be very thin. Meeting point of 4 bones: frontal, parietal, temporal and greater wing of sphenoid. All the three will meet together, and just below this point you have the anterior branch of middle meningeal artery and vein running here. So injury into this place can produce extradural hematoma. Alright. This is mastoid process. This is zygomatic arch. Okay. Fine. Let us go to the base of skull. Alright. This all of you should know. If you don't know, then we'll discuss later. But for the nerves, we have to see the base. Clear? This is called norma basalis. What you see here is base of skull from interior. Understood? Okay. Now when you look from here, this all of you know, this is the maxillary arch for the teeth. Clear? Now when you come behind, you see structure here. Alright? This is the pterygoid plates. Pterygoid plate, there are two plates. Lateral pterygoid plate, medial pterygoid plate. Some of the muscles of mastication get attached here. Got it? So remember, this is lateral pterygoid plate. This is medial pterygoid plate. Clear with this? Lateral pterygoid, medial pterygoid plate. Huh? Okay. Now after this, all of you can see. Huh? You can see, then it's fine. Okay. Now just behind this medial pterygoid plate, you have a foramen. Clear? See, always remember in the skull, whatever you have on one side, there should be a replica on the opposite side. So if I show a foramen here, please make sure you see the foramen on the other side also. So this is called the mandibular foramen. All the foramen in the skull are important because that's a common question asked. Identify the probed foramen. What are the structures passing through this? Understood? So this is mandibular foramen. Please make sure you know what are the structures passing through. Huh? Clear? The mandibular foramen has got another name. What is it?
Foramen ovale.
Foramen ovale. Clear? Okay. Just behind foramen ovale, you have another foramen.
Spinosum.
Yes, this is foramen spinosum. Clear? Foramen spinosum. Okay. Right. Behind the foramen spinosum, you have the spine of the sphenoid. So where I am holding is the spine of the sphenoid. Clear? Right? Okay. Now, just behind the spine of the sphenoid, you have an opening. You see this opening here? Saw this? What is this?
Maxillary artery.
Yeah. Foramen rotundum.
I know all of you will say something wrong, but I never thought you will say foramen rotundum. Remember, foramen rotundum cannot be seen from skull base. Clear? Understood? Foramen rotundum cannot be seen here. It can be seen only here. Because it opens here, it opens into a small place here itself. It doesn't come out at all. So never say foramen rotundum. This opening is called carotid canal. What is this called? Carotid canal. Understood? Okay, fine. Now behind the carotid canal you have a large opening here.
Jugular foramen.
Yes, this is called jugular foramen. Alright? Jugular foramen. Okay. If you come forward, it's not seen very well in the other skull. This skull here, many things are, some of them are broken. See here, I have placed the forceps in jugular foramen. Alright? Now in front of jugular foramen, do you see a structure pointing like this, like a tooth? Right? The structure. This is styloid process. What is styloid process? What is styloid apparatus? Yes, what is styloid process? What is styloid apparatus? I didn't do head and neck for you, right? Little bit of head and neck will touch here. Little bit. What is this? Styloid process. What is styloid apparatus? Styloid process is a bone. Understood? Clear? Styloid apparatus is this styloid process plus 3 muscles attached to the styloid process. What are they? All the muscles which attach here start with the word stylo.
Stylo.
One muscle goes from styloid process to the tongue. Styloglossus. One muscle goes from the styloid process to the pharynx.
Stylopharyngeus.
Stylopharyngeus. Another one goes to hyoid bone. It is called as
Stylohyoid.
stylohyoid. All these 3 muscles put together, it is called as styloid apparatus. Understood? So if you come across the word styloid apparatus, don't confuse what it is. So this is styloid process, huh? So question I can ask you is very simple. What is the ligament attached to this?
Stylomandibular ligament.
I won't ask what is the muscle attached. You will answer now. What is the ligament attached? Yes, stylomandibular ligament. It is related to TM joint. Understood? Okay, good. Then behind this, still laterally, you have this process here which you can feel. This
Mastoid.
prominence, mastoid process. What is the common question I ask? I can ask. Yes, G. You have to ask one question so that you should finish off everyone. Yes. It should be easy to
Clinical
answer, but they should
significance.
not answer.
Clinical significance.
Too much. What are the muscles attached? 2 marks. Very simple question. What are the muscles attached? 2 marks. Name the 2 muscles attached.
Sternocleidomastoid.
Yes. See, such a simple question.
Say that.
FCM.
Confirm SCM.
Yes, what is that?
Sternocleidomastoid.
Sternocleidomastoid. The name itself says. Okay, 1. Next, 1 mark. What is that other muscle? No. See, I told you very simple question. Posterior belly of digastric muscle
Oh.
attaches here. See here, sternocleidomastoid will attach on the outer surface, that is laterally. Medially, you will have the attachment of posterior belly of digastric muscle.
Right.
Understood?
Mhm.
Such a simple question. I told you, should ask simple question so that nobody answers. Okay. Now remember, between the mastoid process and the styloid process, you have a foramen here. That is called stylomastoid foramen. See here, this styloid process is broken here. Styloid process, mastoid process. You have a foramen here. This is called stylomastoid foramen. Understood? What is the question I can ask?
Structures passing.
Structures passing through is the only thing I can ask. But I'll ask you, state the cranial nerve that passes, comes out of this foramen.
Finish.
Sternocleidomastoid.
Yes? How many of you agree with facial nerve? Okay. Since I don't know why he's saying something, accept. At least go with the crowd. If you don't know what is happening, go with the crowd. Yes, it's facial nerve. At least you will get it correct sometimes, occasionally, rarely. Understood? So this is facial nerve that comes out of this
Facial
foramen.
is 7.
This opening is
Foramen magnum.
foramen magnum.
Spinal cord.
Clear? Okay. Now Which is the 12th cranial nerve?
Hypoglossal.
Hypoglossal nerve, right? Hypoglossal comes out through a canal called hypoglossal
Hypoglossal
canal. So this is hypoglossal canal here. Remember this. See properly. This is the foramen magnum. This is the anterior, this is the posterior. Hypoglossal canal comes out anteriorly. Clear with this? Posteriorly you will have a opening here. Do not say this is hypoglossal canal. See here? This is not hypoglossal canal. Don't worry about this, because we won't ask you what is this. This is important. Understood? Many students, hypoglossal means first thing they always see here and they mistake. It's always in the front of foramen magnum or just by the side of jugular foramen. Understood? Okay. Now let us go inside. Let me see whether I have finished everything. See, this is the hard palate. Alright? Soft palate will be hanging here. This is the hard palate. Now, connecting the hard palate to the ethmoid bone and sphenoid bone, see you have a projection here. See this?
Nasal septum.
Which forms the part of nasal septum. Understood? Yes. What is this bone?
Yeah.
This bone is called vomer. Clear? I told you, right? Go with the crowd. Rarely you will get it correct. But still, anyway, everybody will be there, right? Making the mistake. So what you do gets diluted. This is vomer, huh? This is hard palate. And here you have a small opening here. This is called incisive foramen. Okay? Right. Anything else I have to say here? Already too much for you. Now, interior of the skull, it's divided into three parts: anterior, medial, and posterior cranial fossa. In the anterior cranial fossa, two important things you have to identify. See here, this is the orbital plate of frontal bone. So you break this, you go into the orbit. But that is not important here. In between the two orbital plate, see you have a small area with lot of holes in it.
Cribriform
Yes,
plate
that
of
is
ethmoid
called.
bone.
See here, small plate with holes in it. This is called cribriform plate of ethmoid
Ethmoid.
bone.
Olfactory.
Olfactory.
Clear?
The root
It is
plates.
through this olfactory nerves will come into the nasal cavity. Understood? Okay, fine. Now in the middle of this cribriform plate of ethmoid bone, something is standing up, right? Something is projecting, right? See this? What is this called as? What is attached here? Yes, wonderful. That's called crista. Yeah, like
Crista galli.
this is called crista galli. What is attached here?
Superior sagittal sinus.
One of the dura
Fox.
metaphors.
Just the
Fox
Fox
cerebri.
unknown.
Clear? Alright? So fox cerebri goes in the middle. What are the contents of fox cerebri? Name the three sinuses related to fox cerebri. Superior sagittal sinus is one.
Inferior sagittal
Inferior
sinus
sagittal
one.
sinus is one. Yes. On top of tentorium cerebelli, where fox cerebri gets attached, you have straight sinus. Understood? Okay, good. Fine. So you know this. What is the function of fox cerebri?
Divides the brain into
Two hemispheres.
two hemispheres.
Anything else? It reduces the rotational force of acting on the brain. Understood? See, already brain is floating inside CSF. Suppose I turn this side, if there was no fact cerebri, brain will be still standing here, I will be looking here. Understood? Because of fact cerebri, whenever I move, brain also moves in the same direction. Understood? Otherwise, brain will start rotating on its own axis. Another solar system will form. No, that means you will see stars. That's what it means. Huh? Clear? Okay. This is Crista Galli. That's also an OSPE question. When you still come backwards, you see these two projections here. You see these two projections. One year. This is anterior clinoid process. Anterior clinoid process. Now just behind this you have a depression here.
Sella Trisica.
Yes, this is sella turcica. This. Alright. Otherwise, even if you write pituitary fossa, also same.
Oh.
Clear? Now, what is the question I can ask? Very simple question I can ask.
Clinical significance.
Sella turcica. Sella turcica. I keep clinical questions for when you think you know everything. That's the time you will just like our Malaysian tolls. You know, when you drive a car, you will feel for some time I'm not paying any toll. Immediately one toll will be there. It's always like that. They will never let you think that you are free driving for some time, right? So I'll keep questions like that. Sella turcica, the most common question asked is, what is the relation of this pituitary fossa?
Right.
What are the structures related laterally to pituitary fossa?
Cavernous
Cavernous
sinus.
sinus.
Yes, on both the sides you have cavernous sinus, superior relation,
Pituitary gland.
optic chiasma.
Oh.
Understood?
Right.
That's why you invite.
Sella turcica is present on which bone?
Sphenoid.
Sphenoid.
Sphenoid bone. That's another question. That's why inferiorly you have sphenoidal air sinus.
What bone forms the
Understood? Okay. Fine. Let us identify some openings. Two openings here. See here from the orbit there is an opening coming up.
superior orbital fissure?
Yes, this is superior orbital fissure. Clear? So you can see from here. You can see from here. Superior orbit. Inferior orbital fissure usually we don't keep because there are only very small structures come through there. Understood? Superior orbital fissure is important because all the important cranial nerves coming into the orbit. What are the important cranial nerves coming into the orbit now?
Oculomotor.
Oculomotor,
Trochlear.
Trochlear.
Abducens.
Abducens. Understood? All the branches will come through this, including ophthalmic division of trigeminal nerve.
Right.
Clear? Those branches also will enter through this. Clear? Okay, that's why superior orbital fissure is important. Now, next to superior orbital fissure, we have another canal which we keep. Optic canal. See here? Optic canal. What is the question I can ask? Structures passing through. What are the structures passing through optic canal?
Optic nerve.
Optic nerve.
Optic nerve. Ophthalmic artery. Understood? The king and queen of orbit always pass through optic canal. Understood? Who is the king, who is the queen, we don't know, but still. Understood? Okay. You have superior orbital fissure, optic canal you have identified. Now below superior orbital fissure, I have kept an opening here. This is foramen rotundum.
Now rotundum.
Here, this is foramen rotundum. Understood? And foramen just below superior orbital fissure is foramen rotundum, which now passes through this.
Maxillary.
Maxillary.
Naturally maxillary, because ophthalmic division passes through superior orbital fissure. Mandibular division passes through mandibular foramen or foramen ovale. So in between these two there is only one foramen left, that is foramen rotundum. So maxillary division will pass through it. Clear? So these are three divisions of trigeminal nerve. All right. So all of you identified foramen rotundum. So always remember, foramen rotundum does not, or it's not seen in the base. Clear? Understood? Okay. Now comes the next interesting question here. Okay. Sometimes these foramen are nicely seen only in artificial bones. Huh? Okay.
Is not foramen Ohio.
Keep it like this. See here, just medial to foramen, this foramen ovale. Okay, I'm just keeping it like this. This is foramen ovale. Alright? Now medial to foramen ovale, you have an opening here. Alright? Which you can see here also. From inside. What structure passes through this? If you answer this, we are done with skull. There are only funny things about skull. This is called foramen lacerum. Now what structure passes through foramen lacerum? Internal carotid artery passes through foramen lacerum. Then what passes through carotid canal?
There's nothing passing through any cartilages
Which one?
for foramen lacerum.
Sure.
Yeah.
Definite.
Yes.
Confident.
Yes.
She is correct. Internal carotid artery passes through this. Then what passes through carotid canal? See, that's what sometimes, when they used to say there's a fight between two people. One fellow will say, I saw the rat going this side. The other fellow will say, no, it went this side. So when he saw the rat went this side, the other person saw the rat went that side. So both are correct from their viewpoint. So like this, he is also correct. Nothing passes through foramen lacerum. It's closed by fibrocartilage, yes. And she is also correct. Internal carotid artery passes through foramen lacerum. How it happens is, it's like this. Simple diagram. You have petrous part, there is something called as petrous part of temporal bone. Understood?
Right.
Okay? That is this bone that you have, right? This bone. This is petrous part of temporal bone. Here. Now what happens? There is one opening here which is called the carotid canal like this. At one end you have the opening of foramen lacerum. Clear? Why it's called foramen lacerum? Because the border is always, yes, serrated edge, very rough. Clear? Now if you observe or pass anything into carotid canal, it will not straight go inside because there is no opening for carotid canal inside. Understood? So what happens to carotid canal is, the carotid canal will go like this and it will open into foramen lacerum in the upper part. Okay? So carotid canal will open like this. So carotid artery will enter into the canal, it will pass like this and it will then come out like this. Understood? Now what she told was correct. Internal carotid artery comes through foramen lacerum. The only change that she should make is, it is in the upper part of foramen lacerum, you have the internal carotid artery coming out or coming into the skull. Understood? Now E is correct because foramen lacerum, when you look from the base, it is closed by a cartilage. Nothing directly enters into foramen lacerum.
Okay.
Understood? Clear? So always remember, foramen lacerum is always tricky, and carotid canal is also tricky, because carotid canal you cannot see from inside. Carotid canal is always seen only from base. Understood? Got it? That is why when you study about the middle ear, you will have the carotid canal related to one component of middle ear also. That is because it passes through petrous part of temporal bone. Understood? Clear? Okay. So this is important, huh? Clear with this? So all of you should know, when you write about carotid artery, particularly internal carotid artery, you should make sure that you say that it enters through the carotid canal, passes through the carotid canal, and then comes out or enters the skull through the upper part of foramen lacerum. Understood? So entry at one point, exit at one point. Understood this? Clear? Okay. Right. So you should know this. Okay. The next important thing that you identify here is this bone that you see here. This is petrous part of temporal bone. This is petrous part of temporal bone. This bone. What are the structures present inside the bone? Yes, you have carotid canal. Next. Why again and again I am stressing that bone? What is inside the bone? Name some important structures present inside this bone.
Petrosal nerve, maybe. Subtarsal nerve.
Okay, internal acoustic meatus is this opening here. See, this is internal acoustic meatus. Alright? Okay, this is one opening. What are the important structures that are present inside this bone? Remember, this is one of the strongest part of skull. That's why even in major accidents, people don't get bleeding from ear. Understood? Because this is a very strong bone. Clear? But remember, whenever this bone fractures, fixing this bone becomes very, very difficult. And the important structure that is present here is, suppose if you pass through here, first structure that you will come through is, what is this?
Internal acoustic meatus.
External acoustic
External
meatus.
Yeah.
If you pass through, what is the first structure you will get?
Tympanic nerve.
Tympanic membrane. Next to tympanic membrane,
Auditory ossicles.
what is that cavity called?
Middle ear.
Middle ear cavity. Understood? So middle ear cavity is present in this. Next, if you pass middle ear cavity, you have to go into
Inner ear.
inner ear. What are the structures present in the inner ear?
Cochlea.
Then
Uh,
cochlea.
yeah.
Cochlea is important for
Sound.
Conduction.
hearing.
Hearing.
What is the other structure?
Vestibule.
Okay, you have utricle, you have vestibule. What is the structure that is attached to vestibule or utricle?
It's the PD.
Once I draw, all of you will know what it is. See here, you have the cochlea. Attached to the cochlea, you will have two other structures here. And attached to this structure, you have
Oh, the
semicircular canals. All the structures are present inside the petrous part of temporal bone. Understood? That is why this bone becomes very, very important. Once this bone breaks, to align it, it's very, very difficult. and the person will have vertigo, all complications related to,
Loss of balance.
yes, balance, posture and balance. Clear? Okay. Of course, this is foramen magnum, this is jugular foramen, this all of you know, hypoglossal canal also you know, fine. Now whatever I tell you now, it won't be retained in your brain at all. Clear? That is because external acoustic meatus, internal acoustic meatus on both sides, and this external acoustic meatus, all of them are in the straight line. So whatever I tell you here, it straight passes through this and goes out through this. See, it's anatomically it's proved. Clear? There are many things in life, practical things that are proved anatomically. We anatomists are very great, but unfortunately we don't show ourselves off like what clinicians do. Right? Have you heard of the word love is blind?
Yes.
Is it really true or not? Anatomically, yes, it's 100% true. See, when a boy and a girl come in close proximity to talk, right? The body starts secreting which hormone? Adrenaline. Clear? Start secreting what? Adrenaline. Adrenaline is parasympathetic or sympathetic?
Sympathetic.
It's a sympathetic drug. What happens? What happens to the sympathetic effect on iris?
Dilation.
It becomes constricted or it becomes dilated?
Dilated.
Dilated.
See, boys know everything but they suffer. Girls don't know anything but they are happy. They never constrict. Sympathetic always dilates.
Only dilate.
Yeah.
Parasympathetic is the
Only
one that will
constrict.
constrict the pupil. When the iris dilates, the pupil size becomes
Larger.
big. When pupil size becomes big, what happens? Lot of light will fall on the retina. When lot of light falls
The
on the
visible light.
retina, remember, your vision becomes blur. Understood? So you won't know to whom you are giving acceptance to. Understood? Clear?
So doctor, so in like a fight or flight scenario where adrenaline is released,
Huh?
in a fight or flight scenario where adrenaline is released and the people are dying,
Yes.
will it be harder to see?
Yes, that's why many people they feel somewhat vision becomes blurred. They don't know what to do, right? So they cannot decide.
Right range.
It's parasympathetic that will help you to give clear vision because it constricts the pupil. Understood? So it is proved that this is the reason. The same thing again. The same thing happens for the eyeball. If you look at your eyeball in the mirror, you will see it keeps on shaking. Yes or no? But of course, this has got nothing to do with romance, but it keeps on shaking. Have you observed this? Is it normal or abnormal?
Normal.
Normal. Eyes have to move, keep on moving, because a vision or a light once falls on the retina, if it keeps on falling on the same place, your vision will be
Destruction
lost.
of the rod and
So
also.
it has to fall in different places. That's why it keeps on shaking. Clear? Okay? Now, why I came to say this is, remember, you have some muscles that are present. They are called as extraocular muscles. They are very small muscles. Clear? Now what happens whenever these muscles have something called tone of the muscle, which all of you know. Now when a person is driving a car, for example, take myself, for the first time I have been given a racing car and I am driving it on a highway. It's my first time. What happens? Body starts secreting adrenaline. Adrenaline increases the tone of the muscle. Understood? That's why you get ready for fight or flight. Understood? Now the same thing, the muscle tone, everything becomes tight for a skeletal muscle. Same thing happens to the muscles of the eyeball, extraocular muscles. When all the muscles become tight, what happens? The physiological nystagmus will stop. That's why you try to hold your eye using both the hands, you will see vision is lost in that eye. Understood? So immediately the eyeball stops moving, the vision stops, because light will be falling on the same part of the retina, your vision is lost. Understood? So once the vision is lost, even for few seconds, you lose control. Many people meet with accident when they drive fast because they are not trained to keep their eyeballs in the normal physiological nystagmus, even when the adrenal level is very, very high. So when you drive or when you race road rage for the first time, your adrenaline level is always very high. So there is more chance you are going to lose vision at one point. Remember, the thing is, this loss of vision is only for a few milliseconds. Understood? But once you lose control of the car, that milliseconds is lost. When you get up, you will see only lights like this, that will be operation lights, not the car lights. Understood?
Yes.
Okay? So now you know some structures here. Alright? Let us go to the brain. Alright. In brain we see the cerebral hemisphere, cerebellum, and we see the brainstem. In cerebral hemisphere we see the superolateral surface, medial surface. Understood? Then we have inferior surface. Understood?
Yep.
Now when you divide the brain into two half like this is called the inferior surface of brain. When you put both the parts together, this becomes the base of brain. Understood? Clear with this?
Yep.
Okay. Now we won't go into too many sulcus, already too much of information for you, but still anyway. This is the longitudinal sulcus. Alright? Okay. When you come to the superolateral surface, this is lateral sulcus. In this, there is nothing much to ask except fact cerebri, but lateral sulcus is important because it has got a stem and a posterior ramen. Clear? So the place where the lateral sulcus begins here, this area is called the stem of lateral sulcus. Stem of lateral sulcus. Understood? I told you pterion, right? If I puncture pterion, I will straight go to the stem of lateral sulcus. So this is the surface landmark for stem of lateral sulcus. This is the posterior ramen. Clear? Posterior ramen of lateral sulcus. Fine. Once you know this, two sulcus, then we have to know what is known as central sulcus. This is central sulcus, approximately in the middle. Clear? So it has to start from the medial side and it has to continue here. So this is central sulcus. Okay? Fine. Once you know central sulcus, you should know the gyrus that is present on both in front and behind. Anything that is in the front, it is?
Precentral.
Yes, precentral. This postcentral. Precentral is motor, postcentral is sensory. Clear?
Yeah.
Okay. Now based on this, we can divide the brain into lobes. Frontal lobe, parietal lobe, occipital lobe, temporal lobe. Clear? Theoretically, how we divide? You have to read by yourself. Huh? These are the lobes. Okay? Now I can always put a pin here and say identify the part of the brain.
Occipital.
Yes. Then I will ask you what is the?
Broadman's area.
Broadman.
What is the?
Broadman's.
Yes, Broadman's area related to this.
Something.
So all the things here are related to Broadman's area only. Okay? Right. Now from the stem of the lateral sulcus, this is the stem, right? From here you see a sulcus going above, right? This divides this part, and this area is
Broca's
very, very
area.
important. This is called as
Broca's.
Broca's area.
Wing.
Okay?
Yeah.
This area is called as Broca's area. Numbers you should remember, some of them. Occipital you should remember.
44.
Broca's area you should remember.
5.
Then you should remember the precentral and postcentral numbers. Very, very important.
44, 45.
Clear?
3, 1, 2, 4. Somatosensory.
Clear? Right. Next. Here you have Broca's area. Just below the lateral sulcus. Just below the lateral sulcus here, you have the Wernicke's area for hearing. All right? Okay. Let us see what other sulcus we can ask.
4.
Okay. Now see here. This is the central sulcus. All right. Now we have the precentral gyrus, postcentral gyrus. This is the medial surface of brain. Huh? This is the central sulcus. See here, I told you this is central sulcus, right? So this is the central sulcus. We have these two gyrus here. These two gyrus usually should join with one another, and that structure is called as paracentral lobule. So if I put a pin here and ask what is this, into the sulcus here, if I put a pin here and ask what is this,
Central.
yes, preferably say central sulcus, or you put a slash and say paracentral lobule. Understood? Again, this is what the trick is all about. In the medial surface of brain, any model, if I keep anything in this place, your answer should be? Your answer should be?
Central sulcus.
Paracentral lobule. That's all. If I want to ask central sulcus, I will not go to this side. I will always ask from
Yep.
this side. Understood this? Some of the important key points you should know how to answer questions. This is central sulcus. Yes, I'll agree. But here I won't ask you central sulcus. Here I will ask you only paracentral lobule. So safe is always paracentral lobule. If I want to ask central sulcus, I should, according to rule, I should ask only from here. Understood this? Okay. Now anything in front of the central sulcus is anything is that is precentral, that is motor. This is motor cortex. All these things are premotor cortex. Clear? Now this is a very important area from your point of view. Clear? Now you should know, all of you would have experienced what is the function of this prefrontal cortex.
Processing of motor.
Yes?
Motivation.
Something else?
Goal director movement.
Something else? Behavior, memory, everything comes from here. Understood? Right? See, in the school when you are answering a paper, suppose you don't know any question, keep hitting yourself like this, immediately you will get the answer and you start writing. Have you observed this? That's why people keep their hand like this, immediately they'll get answer. So next time, when you don't get answer in your examination, keep your hand like this and slowly hit yourself. You hit hard, then invigilators have to